The Centers for Disease Control are reporting that pertussis cases are 5 times higher nationwide than at the same point last year and higher than pre-pandemic levels in 2019. Pertussis is also known as whooping cough. In Montana, cases are nearly double what they were last year. And last month, the Montana Department of Public Health and Human Services noted that cases have been reported in at least 14 Montana counties, and most cases occurred after September 1st. Other states in the region, notably Washington, are seeing significant numbered cases. Scripps News correspondent Vanessa Mashunga reports.
Right now, there are about 1,200 cases of whooping cough in Washington state, compared to just a few dozen this time last year. And health experts are stressing the importance of everyone staying healthy, especially young kids and babies. Health officials in Washington state are alerting residents to a sharp rise in cases of pertussis, also known as whooping cough.
Part of it is vaccination rates are waning in pertussis, and this is natural cycle of the disease.
As of November 2nd, the CDC shows nearly 1,200 cases reported in the state. Some 24 people have been hospitalized, including at least 12 infants. There were only 51 cases reported at this time last year. It's spread through cough or sneeze droplets. Symptoms can seem like a common cold, beginning with a runny nose and a sore throat, but it can turn into a prolonged cough.
If that cough is lasting more than what a usual virus lasts, a couple days up to a week, then you should get tested for pertussis.
Nationally, there are more than 22,000 cases compared to just 4,800 at the same time last year. Cases used to be frequent until a vaccine was developed in the 1950s.
Kids need to get vaccinated. These are effective vaccines. They work incredibly well. We can start giving that vaccine to little babies as soon as 2 months of age.
The CDC reports another respiratory illness is also on the rise. Walking pneumonia, in fact, especially among young children, began increasing in late spring, peaking in late August. All this coming as flu season is set to begin its peak period next month. Vanessa Mashanya, Scripps News.
Again, doctors say the best way to protect yourself and your family is by getting vaccinated. And while children are among the most at risk, St. Peter's Health family practice physician Dr. Hannah Mackey says other groups can be severely impacted by pertussis.
At-risk populations are infants. They're younger. Respiratory issues are scarier with kind of that infancy age. That's why we're vaccinating at those younger ages. And then our elderly population and also anyone who's immunocompromised, likely more at risk for kind of those whooping cough, the bacterial infection.